Do not attempt any massage without proper instruction. Your therapist should check for contraindications, which will mean massage may not be safe to perform. We're going to demonstrate some simple techniques for applying sports massage to the front of the thigh. These are excellent for helping to recover from a thigh strain or tear of the quadriceps muscles. They can also be performed on a regular basis to help prevent injury and keep muscles in good condition. The first technique is effleurage, or light stroking, applied to the front of the leg. Try to cover as much of the surface area as possible, applying gentle pressure on the upstrokes, but bringing the hands lightly down the side of the leg, still in contact with the leg, but avoid applying pressure. The aim here is to spread the oil and gently warm the area in preparation for deeper techniques. The next technique is deeper effleurage, concentrating on the thigh only. Apply pressure on the upstroke as before and gently down the sides. After a few minutes, you may be able to feel any lumps and bumps or tight knots in the muscle. Try to use slow, smooth movements. You can always come back to effleurage techniques at any time during the massage to add variety. The next technique is Petrissage. These are kneading type techniques aimed at manipulating the muscle tissue between the hands. There are a number of different Petrissage techniques that can be applied. With the hands, apply a firm, circular kneading technique. Work your way up and down the muscle, trying to cover as much of the surface area as possible. Apply this technique for around 2 to 5 minutes, alternating with effleurage to add variety. The next technique is a technique called stripping the muscle. It involves applying sustained pressure along the full length of the muscle with the thumb. It's this technique that you can really get in deep to treat any tight knots in the muscle. This technique may be uncomfortable if performed deeply, but it should not be so painful that the athlete tightens up with pain, because you're just working against the muscle then rather than getting the full benefit. You can repeat stripping the muscle 3 or 4 times in a row, alternating with Petrissage techniques to break it up. A good therapist can really build up a mental picture of the condition of the muscle, identifying any specific areas of tightness. If you find a specific tight spot, then this can be treated with small circular frictions. The iliotibial band is a long tendon that runs down the side of the thigh. This can get tight, causing iliotibial band friction syndrome at the knee. Apply sustained pressure with the heel of the hand along the full length of the iliotibial band. This technique can be uncomfortable or even painful, so start gently. Any lumps and bumps or particularly sensitive spots can be treated with deep sustained pressure to the points using the thumbs. This is a technique called trigger pointing. Increase the pressure on the point until it ranks 7 out of 10 on the pain scale, with 10 being most painful. Hold this pressure until it eases off to around 4 out of 10, and then again, without easing pressure off, apply deeper pressure till it reaches 7 out of 10 on the pain scale again. Repeat this 2 or 3 times. This technique is very hard on the thumb joints. It's important to keep the thumb slightly bent or flexed when applying pressure to avoid damaging the joints. Fingernails also need to be short to apply this technique correctly. The massage can be finished off with more Petrissage and finally effleurage techniques. To massage the front of the thigh can take between 3 and 10 minutes. Massage therapy can be applied every day if it's performed lightly, however deeper techniques may need a day's recovery between sessions.